Hello, I'm Dr. Shayla Toombs Withers, family physician here at Essence of Health Wellness Clinic. Thank you for joining me today. Here in the United States, we continue to see an increase of active cases of coronavirus as well as deaths related to coronavirus. One of the questions I am commonly asked nowadays is, well, when do you think this will end? And the other question I am commonly asked is, how can we get back to some sort of normalcy? Both of these questions are challenging to answer because there are still many things we have to learn ultimately to combat this virus. So the short answer is I don't know. However, the longer, more thought provoking answer is what I will be discussing with you all today. We make everyday decisions based upon a number of factors that include thoughts of, will this be helpful to me? Will this be harmful to me? What happens if things don't go as I plan? And am I willing to take the risk of a poor outcome if I proceed with my plan? So, when it comes to living life during the COVID-19 era, we also have to ponder many of these same thoughts and calculate our risk. So, the first step in determining the risk of something is knowing the numbers that exist. So, let's take a look at the current coronavirus data from the United States. This data was obtained from the Centers of Disease Control and Prevention, the CDC, and it is current as of July 16th. What we know about the data is each state and the CDC doesn't release that day's report until later in the afternoon and evening. So, when looking at this data, the total United States cases of coronavirus is now at 3,483,832. The total United States deaths is 136,938. While some states are no longer reporting their data to the CDC, we do know that the majority of states have now had over 40,000 confirmed cases of coronavirus, with many states reporting hundreds to thousands of deaths due to coronavirus. Here in the state of Tennessee, we have had over 71,000 confirmed coronavirus cases and 796 deaths. And here in Chattanooga, where Essence of Health Wellness Clinic is located, we have seen a consistent trend upward in the number of new coronavirus cases, the number of hospitalizations, and in the number of patients requiring intensive care level of care in the hospital. So, from a numbers perspective, taking into account the number of cases of coronavirus present in our country and in our community, we can see that the stakes are still high. Now, the next step in determining if you are taking a risk, if it will be worthwhile in doing so, is to know your chance of possibly having a poor outcome. So, this brings us to another set of numbers to consider. The Georgia Institute of Technology, Georgia Tech, has developed a COVID-19 event risk assessment planning tool. I will place a link to this in the comment section of this video. This tool takes into account the risk level of attending an event given the event size and the location of the event. And it gives you an estimated chance ranking from 0 to 100% that at least one COVID-19 positive individual will be present at an event in a county given the size of the event. So let's break that down a little bit. So, for instance, let's say you are considering dining at a restaurant that may have 25 people inside of the restaurant in total, including staff present at that same time as you are. If you happen to be here in Hamilton County, you have a 55% chance of coming into contact with the COVID-19 positive individual while dining at this restaurant. However, if you are dining in Nashville and Davidson County, under these same stipulations, you would have an 88% chance of coming into contact with the COVID-19 positive individual. Let's look at another scenario. one in which you went to partake in fun activities at the beach. One could estimate that you may at least be around about 100 people at any given time while at the beach. If the beach is located in Savannah, Georgia, in Chatham County on the East Coast, your risk of coming into contact with at least one COVID positive individual would be greater than 99%, meaning you most certainly would come into contact with the COVID-19 positive individual. And likewise, a beach venture at a beach in the Gulf of Mexico or in Southern California on the West Coast would also give you a greater than 90% chance of coming into contact with the COVID-19 positive individual. So, now that we know the prevalence of coronavirus and we know our risk of coming into contact with coronavirus, the next step in making a calculated plan is pondering, are you willing to take the risk, and what could be your potential outcome for taking such a risk? And ultimately, this answer lies within each one of you and is a decision of your own. However, here are some facts that would be good to consider. Consider if you are a high risk individual for developing severe illness from coronavirus. Individuals over the age of 60 are high risk. Individuals who have a body mass index BMI over 30 are high risk. Individuals who suffer from chronic health conditions, including chronic kidney disease, type 2 diabetes, chronic obstructive pulmonary disorder or COPD, heart disease, sickle cell disease, are all high risk. Individuals who may have a weakened immune system, including those with cancer, those with HIV or AIDS, those who have received an organ transplant, are all high risk. Another fact to consider is who you may live with or have to be in close contact with. Are they a high risk individual? You may not personally fall into a high risk group, but your family member who lives in your home or your coworker who you routinely work closely with may be high risk. So, a positive coronavirus infection may not have a detrimental impact on you personally, but you spreading that virus to someone else may have a detrimental impact to them instead. Ultimately, there is no way to ensure a zero risk of coronavirus infection because we still must do essential things like work, obtain food, home supplies, educate our children, and be able to enjoy some fresh outdoor air. But taking precautionary measures like wearing a face covering to cover your nose and mouth, keeping 6 feet of social distance between yourself and others, washing your hands frequently with soap and water, or at least a 60% alcohol based hand sanitizer can be helpful in reducing risk of infection to yourself as well as others. We know that social interaction is important, but visit with others outdoors at a safe distance apart. Use an alternative greeting other than shaking hands. Consider small outdoor activities where social distancing can be maintained and avoid large gatherings. Remember, the essence of health is in you. Thank you for joining me today. Stay safe out there. Again, I am Dr. Shayla Toombs Withers here at Essence of Health Wellness Clinic in Chattanooga, Tennessee. I am accepting new patients. You can learn more about my practice at www.essenceofhealthwellnessclinic.com. You can also find me on Instagram at Essence of Health Wellness Clinic, on Twitter at EOHWC underscore DPC, and also on YouTube at Essence of Health Wellness Clinic. Take care. I will see if I have any live questions at the moment. And as always, feel free to leave any additional questions or comments in the comment section of this video. I hope everyone has a safe day. Thanks for joining me. Bye bye.